We appreciate everybody being on the webinar here today. This is our first 2024 Dairy Goat webinar for the year. If those who have registered in the past know that we've had this in 2023, and we wanted to continue our Dairy Goat webinar series. So we thought this was a very timely topic, talking about nutritional management for the close-up doe. And we really appreciate having Dr. Andrea Mongini here. She's a partner in M&M Veterinary Practice, which she operates with her husband, Dr. Craig Meadows. And the practice specializes in dairy cattle, dairy goats, and dairy sheep, with an emphasis on herd health, nutrition, and production management. And Dr. Mongini has a master's degree in nutrition and provides nutrition and management consultation to small ruminant dairy operations across the United States. She also owns and operates Ewetopia Dairy, a 300U East Frisian dairy. She was awarded the AASRP Small Ruminant Practitioner of the Year in 2023. So we're happy to have you on. And it sounds like you're a very busy person. So we appreciate the time that you're taking here today to talk about nutritional management for those close-up does. As we were kind of chatting here in the chat box, a lot of people are getting ready to kid here in the next couple of weeks. So I think your information will be very good for them. So with that, you go ahead.
Oh, thank you. Thank you for that nice introduction, Jennifer. It's great to be invited to speak here. And again, I'm so sorry that I'm late, but I do think that this is such a good topic for this time of year, because most of us, in January are thinking about close-ups, and in February and March, we're going to be kidding really heavy. So this talk is really, I'm going to talk about pregnancy toxemia, because that's really what we're worried about and what we're managing when we're managing close-up goats, dairy goats. So I want to talk about pregnancy toxemia and some diagnosis and how I like to score cases to help so you can have a feel for what you're dealing with in terms of the severity of the case. And so we're going to walk through some basics of treating these cases, and that's really the management part. And then we're going to talk about nutrition, and I want to talk about how you can feed to prevent pregnancy toxemia and, sort of turn these cases around. We're going to talk a little bit about fresh goats. That's really another big topic. So we're going to touch on that briefly at the end. But a lot of the close-up management and nutrition will have a big impact on your fresh period. So if we get this phase right, I always say that the does should just blow and go, should kid out and take off and never look back. So this, I think, is the most important time in the goats, sort of really in their lifetime, because if we get through this phase, then we have a living goat and living kids. So first, for those of you that aren't familiar, and for those of you who are, what is pregnancy toxemia? Pregnancy toxemia occurs in the last month of gestation, when the energy demand is greater than the energy intake. So in any scenario, that has to happen to induce pregnancy toxemia, and that is what's occurring. There's two types. So there's fat does with ketosis. So what happens is these goats are not getting enough energy in their diet to satisfy the requirements for themselves and the growing kids. And so they start burning fat, adipose, to make up for that energy, the negative energy balance. And we develop a ketotic syndrome. The second type is a thin doe, or ewe, that has a severe negative energy balance. So these does don't have fat to burn, and they may or may not show ketosis on a BHB meter or a urine test strip, or if you're lucky enough that you can smell ketones. These does don't really have a lot of adipose. They're thin. They don't have the fat stores to burn. But in either case, we end up with a similar syndrome. So first, we're going to touch on the fat does with ketosis. I see this. It's interesting because I would say in goat dairies, there's different ways that we create these scenarios. And so the fat does are common with especially these long lactation herds where we have does. These are some goats from a dairy that I work with, and they are, they're low production, but these does have all milked over 1,000 days. So we've got some pretty hefty body condition on them, and they are at risk for this pregnancy toxemia if the fresh or the close-up period doesn't go well. I see this much more as a backyard disease, and I don't do a lot of backyard goats anymore. But there's definitely a backyard mentality for a lot of small breeders that you should not give grain to pregnant goats, and we're going to hold off on giving grain until the goat's kid, which is exactly what you shouldn't do. But that is a great way to induce pregnancy toxemia. And again, this occurs in the last month of gestation. So you need to make sure that you're looking at the right animals. If you think you have pregnancy toxemia, they need to be in that last month of gestation. So this is a fat dairy doe. And the reason I have this picture in here is to point out that over her top line and her hips, she doesn't look that fat, but if you can appreciate behind her elbows, she has that jelly roll. And that external fat that we see in dairy goats is often behind the elbow. So you may have does that are older and they're thin. You could have some ribs showing, some hips showing, but if you've got that big shelf behind the elbow, that's still a fat goat. So you have to, when you're assessing body condition in dairy goats, it's difficult because you're not just looking at the overall, it's a beef cow versus a dairy cow, right? They're not going to have that all over fat like a boar goat will. We can definitely have a sharp top line. We can have some sharpness, some bone palpation over the shoulder and the hip. But if you have that roll behind the elbow, then that's still a goat that is pretty fat. The chief complaint, the thing that you're going to see the most is goats that have trouble getting up and down. And we have a decreased appetite. So one of the easiest ways to manage this and to keep an eye on it is to make sure that a skilled person is feeding, somebody that has good observation skills. Ideally, as the owner, you are at least, a couple times a week, you're walking the feed line, the manger during feeding. You'll see the goats that are the slowest to get up, and all those goats need to be pulled. They need to go into a special pen, a special needs pen. That may be all they need is to have less competition. They may need treatment. The other thing we see with decreased appetite is they may get up and eat, but they're the first goats to go lay down. So if they all go eat and they're eating some grain, needing some hay, but within 5 minutes, they're back to laying down again, that goat is also an animal that needs to be pulled. Often I see this in overcrowded close-up pens. And one of the things to keep in mind, which we're going to talk about later, is that these goats get wider, right? So you may, as fresh goats or as far off, just dry goats that are not that pregnant, maybe they're 3.5, 4 months pregnant. They're not as wide as they are when they're close-ups, like this white doe, right? She's two of what she was or what she will be after she kids out. So these overcrowded pens will squeeze out the big goats. They will not fight for feed. They're unstable on their feet, and they will not push in to get the grain. And the other common thing with pregnancy toxemia, of course, is not being fed grain. You can use a urine dipstick or a BHB meter. We're going to talk about that a little bit. And then if you're, like I said, if you're lucky enough, some people can smell ketones. If you're not sure, to me, it smells like rotten or sour onions. I'm not great at smelling it, but I do smell it some. But it really has kind of a putrid, oniony smell, is what I would describe it as. Okay, so basic treatment. If we have a pregnancy toxemia goat that is not eating, right? So anorectic, anorexia is the veterinary term for not eating. Sub-Q fluids. So hypocalcemia is a big part of the beginning of the pregnancy toxemia cascade. So we need to give sub-Q calcium. It needs to be calcium borogluconate, 23%, not CMPK. And that can be SID is once a day, BID is twice a day. And so we're going to give that, so maybe it's 30 cc's in 3 spots, or you could take that 75 divided by 2 and give it in 2 spots, usually over the shoulder, over the ribs, under the skin. These goats at this point go on flunixin. That should be IV. If you are not comfortable giving it IV, you could give it sub-Q. And that's once a day. So that is an anti-inflammatory and a painkiller. And a lot of these animals have, you'll notice when they're not eating that they're also sore and they're painful on their feet. And the flunixin really helps with that part of the syndrome and gets them eating again. And so the goal is to get them eating quickly. So if we can catch them at this phase, we can reverse them and they're fine. Propylene glycol, 70 to 90 mils once a day. You could divide that into 2 feedings, so it could be 35 to 45 mils in over 2 doses. You have to be very careful that you don't overuse propylene glycol because it is an alcohol and it will kill the rumen microbes. So you already have an animal that is not eating well, and you run the risk of pushing them further down the pathway of killing rumen microbes, and that will have a further suppression on feed intake. So too much of a good thing can definitely occur with propylene glycol, and you have to be very careful with that. So once these animals go down and they can't get up anymore, then we're still going to give the sub-Q fluids. So everything we were giving before, we're going to give the flunixin. A lot of times at this point with this second phase, I stopped giving the propylene glycol because they're usually not eating at all. You can go to IV fluids at this phase. I will tell you that, and I can send you a formula or talk to your veterinarian if there's veterinarians on, and we talk a little bit more later. And I think in my notes that are attached to this, I did put in the concentrations of how much dextrose and potassium chloride you would add to the bags of LRS. That said, I find that normally if you are able to, we can reverse them without IV fluids. And I have really gone away from that in commercial dairy settings. So I would say I recommend it less now, but for sort of special circumstances, it does still have a benefit and it does help. So we're gonna cycle back through all of this when we get into the skinny goats because these skinny does are much more common and more important in some ways than these fat goats because that is a much more common syndrome. And so we're going to talk about all this again, in a few minutes. So this isn't the end of this, is what I guess I want you to know. I'm not wrapping it up this quickly. Okay, so for nutrition management, and this is a big part of probably why a lot of you are here, just because it is hard to know how to feed these animals and how to get ahead of it. You want to avoid pen and herd changes, and that's a big part of the social structure with goats. They really have their friends. You don't want them fighting in this point. You don't want them getting knocked over or getting injured. So we avoid pen and herd changes. We build a close-up pen of goats, and we don't add to that very much. Other than taking out and putting in a special needs pen, and those goats usually aren't going to have fighting issues because they're all feeling fairly lousy. Grain, and if you don't have a grain mix formulated for your dairy, you can feed cob, which is corn, oats, barley rolled with molasses on top. So we want those glucose precursors because the kids have a final growth spurt in the last month of gestation. It really starts about 3 weeks before kidding. And at that point, they're mineralizing their bones. So there's a huge calcium draw and they're growing so much, there's a huge glucose draw. So we need to feed the grain for the glucose precursors. Grain is extremely important. For these fat does, 1 to 1.5 pounds per day is adequate. That's going to depend on if you're feeding a grass hay based diet or an alfalfa based diet or a blend. It really depends on your forage quality. And we're going to come back to these numbers more and in more depth. In hay, the does should be eating 3 to 5 pounds per day. Obviously, as they get more pregnant, they're going to be able to eat less. And again, we're going to revisit this, but we need to consider that that hay quality needs to be optimal quality, because if it's coarse or stemmy, or the fiber, they say the lignin is high, that's slower digesting, and these goats have a very small rumen capacity in that close-up period. Okay, so this is really what I want to talk about, and this is a little more of what is common, and I think what we get into on goat dairies. And these are thin does with a severe negative energy balance. So a lot of these does aren't necessarily ketotic. And if you're using ketones as a measure of whether you have pregnancy toxemia or not on your dairy, you have to factor in the body condition of the goats that you're testing. So I do want to just mention this about BHBA. I did a study with Dr. Robert Van Son a few years back, because in the goat industry, we've been using the BHBA meters like we do in cattle, but we didn't actually know what the levels were supposed to be for goats. We were using the cattle levels, and it turns out they're not the same. So as soon as we got over 0.4 millimoles per liter, we consider that we had pregnancy toxemia. So that was an actual case. If we went above 1.2, most of those goats were either severe and almost dead or dead. So goats that maybe didn't die, but survived to kidding and come into their milk. And, ended up being culls or, died. And what's interesting is a lot of these cases that were high, over 1.2 on the ketone meter, they didn't die in the close-up period. They might die 7 to 10 days post-kidding. So they really did sort of a crash and burn somewhere along the way. And it didn't have to be, within days of this reading. They could limp along and kind of fool you into thinking they were surviving, and then really just, really kind of, like I said, crash and burn and just, fall apart and end up either being euthanized or dying themselves. So where we get into this, I like to call it starvation pregnancy toxemia, because that's essentially what's happening with these animals. Is we have large litter sizes. So this doe on the left is obviously on a dairy goat, but you can see her spine is showing, and her neck is thin. So we know that she's a leaner doe, but her abdomen is huge, right? So even if you're not scanning and counting fetuses, which most of us on dairies aren't, we do need to consider the trouble cases and who is a potential problem. And we're going to come into this on the management side, but consider making a problem pen for those animals. So it's anything with large litter size, it's older does, so once you get over, say, 7 or 8 years of age, you're much more at risk of having a difficult kidding. So maybe you don't, even if your doelings are separated, which they should be from your mature does, you really want those older does separated from, say, the 2 and 3-year-olds, because goats, they can be aggressive towards one another. They're not always that friendly with each other. Anything with poor mobility is going to be a problem. And if your diets aren't balanced right, or you have issues with feed quality, that can cause problems. Parasitism and grazing dairies can be a real issue. And I definitely see that in certain parts of the country and at certain times of the year, just because these does are already weakened and they made anemic. And that's just going to put more strain on her body and her liver, and trying to support the fetal growth and then the udder development. Okay, so the first, I've staged, years ago, I built sort of a staging system for pregnancy toxemia, and it really helped me to look at animals and figure out who was affected and how many animals were affected and what level they were at. And this will help you, when I work with clients that are out of state, or, that I'm not actually visiting the herd, once we can learn this system, it really helps to say, well, I have, 1 out of 30 goats total, or I have 5% or 20% or stage 1. So stage 1 is when we start getting swollen, like the ends of the legs are swollen above the coronary band. So like right at the base of the hoof, in the pastern area, that can be puffy. Some people say it looks like the hair is sticking out. They look stocked up. So it's almost like a person or an animal with congestive heart failure, right? Where we have this buildup in the legs. If you palpate them, they're very painful and tender. So they, clients that used to tell me they thought their goats had laminitis. They walk very stiff. They don't stand up as much. So then we have decreased feed intake, right? So the initial problem is the swollen legs, but what it leads to is less feed intake. And now we have pregnancy toxemia, right? We're starting down that cycle of the negative energy balance. No grain in the diet. And I don't see that as much as I used to, but some small producers that I do run into still will get into trouble where they really think that you shouldn't give grain to close-up goats. And that will pretty much always induce pregnancy toxemia. And again, we're going to see that in the larger litter sizes. So a doe carrying a single is probably fine, but if she has triplets or quadruplets, she's not going to be fine. And then low dietary protein. So, cows, they say that you can feed 14%, 15% protein in your close-up diet, but goats need quite a bit more than that, right? We have a high litter size. We're asking these goats to make an udder, to make a lot of colostrum. You have a doe that's going to make 10 pounds a day, 12 pounds a day, and she's carrying triplets, and she's getting a lot more protein. So that low protein in the diet can definitely induce the pregnancy toxemia cascade. if you start seeing this scenario 3 to 4 weeks before kidding, that's a severe case because those kids have just started on their growth spurt. And those you need to know are going to take heroics, and they may or not make it to kidding. If it's within a few weeks, 1 to 2 weeks of kidding, those are often more mild cases, and you can use the treatment plan that I talked about earlier. And we're going to, I think, cycle back on that also. And many of those will survive to kidding and be just fine. You know, calcium, some flunixin. I don't even give propylene glycol generally. I think it causes more harm than good. So I very seldom use it, but a lot of people like it. And I think as long as it's used well, that's acceptable. This doe on the bottom left, this white Saanen doe, she obviously has a eye infection, some issues with her eyes that caused her to eat less. And now she's starting pregnancy toxemia. You can see her pasterns are swollen, especially in the front. This doe on the right has some conformational issues. She's actually an old doe, but she's within a few days of kidding, but you can see she's very dropped in her pasterns in the back and in the front, and she's starting to swell up in her legs also. So if you can appreciate from the knees down, she's got some pretty big forelegs there, and those are bigger legs than they should be. So stage 1, we have swollen distal extremities. We've already talked about all these things. This is another doe. This is an old doe, right? So she's just broken down. So you can see her lower legs in the back especially are really starting to break down enough that she's just not getting around very well. And then she's at risk. And she started with the stage 1, walking stiffly, painful legs. This is stage 2, and this is actually one of my dairy ewes, but I really like this picture just because you can see she's got a really thin neck and you can see her spine, but if you just look at her, she looks like a big fat ewe. She had 4 lambs that were 8 and 9 pounds total coming out. So that's, close to 40 pounds of lambs in her. In stage 2, we can start seeing neurologic signs. So there can be head pressing, there can be weakness, more weakness in walking, tremoring, visual deficits. So sometimes people, you think that they're going blind. We can get stargazing where when they sit, they're holding their head up, like they're lifting it up towards the ceiling or the sky. And then of course we have anorexia, so they're not eating. The polio signs we need to treat, which we're going to get into. We've seen this doe, and this is actually the wrong picture. This top doe is obviously not a thin doe. The bottom doe is a 10-year-old doe that was so she's starting with the stargazing. She was blind, and that's why she's in here. But again, she's 10, she's old, and she was not getting managed properly with grain. And then we've kicked her into the next phase now because they missed her with the early weakness. Stage 3, we have severe polio signs. A lot of these goats sleep a lot. And at this point on a goat dairy, you're usually euthanizing these animals, or they're euthanizing themselves. There's a lot of fluid buildup on the lungs, and it can sound like they have severe pneumonia. And that's really, I think, secondary to heart failure. And then the fluid's building up because they just can't, they're having major organ failure. This doe on the bottom, for those of you that are using PG600 and cedars, you've probably all learned that if you give the wrong dose of PG600, you can super ovulate your does, and this will definitely get you into this severe pregnancy toxemia pretty quickly. So this doe doesn't want to flex her front legs. This boar doe on the bottom, you can see her legs are straight out in front of her, which is common. They're so painful. She obviously had 6 dead kids. This was about a week premature. She went into heart failure 2 days later. So even though we did remove the kids, it wasn't enough. And on a dairy, you have to be really cognizant of obviously doing C-sections, because even if you save these does, most of them will not come into their milk. So you can get them back and you have a living dry goat. And unfortunately, in a dairy setting, that's has very low value for us. Okay, so stage 1, we want to find the cause of the pregnancy toxemia, and that's important. So in a dairy setting, it could be disease, like in this case, this doe has what we call pink eye. It could be foot rot. It could be extreme severe CAE and arthritis. And oftentimes it's going to be nutritional, and it might be nutrition management and not necessarily the diet, but the way you're presenting that diet to the animals. So we need to find the cause. We're going to increase the diet grain. So I want these does, if we have thin does or we have this pregnancy toxemia popping up, I want the grain ration to go to 1.5 to 2 pounds per day. Alfalfa and grass hay or either or need to be fed free choice. They need to be really good quality, best quality you can find. So really we want to allocate the best quality feed to the close-ups and to the fresh goats. And then the rest of it we'll figure out later. But if you need to pick who you're going to save that best feed for, the close-up phase is very, very important. We want to raise the dietary protein to greater than 17%. And then there's some nuance there because it's not really that simple. We want to balance the starch, the sugars and the proteins. So if you have, say, rapidly digestible starches, sugars, molasses, ground corn, we need to have proteins that are more rapidly digestible also, and vice versa. So any system can work, but balancing the starch and the protein probably will require some help from a nutritionist. But that does really make a difference with dairy goats, especially if you're going for high production and long lactations. A lot of that starts in the close-up period, in the fresh period. But if you're not using a nutritionist, and you're doing this on your own, then I would tell you 1.5 to 2 pounds per day of grain in that close-up period, and the best quality free choice hay that you have. And you can clean stems out once a day and feed that to your far-off goats, feed it to your bucks. I don't care who eats that, but those close-ups need to have leftovers and it needs to be amazing stuff. Okay, we're going to skip that. For the medical treatments, at this point, we're worried about these animals being off feed, and we're worried about developing neurologic signs. So we use vitamin B complex. You can use thiamine, that has a different dosage. I like to treat that every 12 hours, twice a day, and then 12 hours past the recovery from symptoms. So she might get it for 2 shots or 5 shots. You really can't hurt them by overdosing thiamine or B vitamins. Again, we're using pain medication for the swollen legs and the painful walking, and that's flunixin. Calcium again, and propylene glycol, right? Because these goats should still be eating some, they should be eating less, but they shouldn't have stopped eating, and they should still have a functional rumen at this point. So now we're in stage 2. This is the formula for lactated ringers, which is LRS. If you want to set up IVs, if you're adept at it, your veterinarian can help you get started and teach you the system. But there are plenty of people that are running their own IVs. On a large goat dairy and on most commercial goat dairies, I don't find this is practical and we don't do it. We just get really good at intervening in stage 1, right? So we really just try and not get these goats to this phase. And stage 3 is really, she's got 2 hooves through the pearly gates and she's just decided if she wants to keep walking forward or not. I will tell you that in a goat dairy, if you get to the point that these goats are down, you're either going to euthanize them because it becomes not humane to keep them alive and let them keep suffering, or you're going to induce pregnancy. You're going to terminate the pregnancy. We use prostaglandin, you use dexamethasone. If you're doing that, you would expect kids in 24 to 36 hours. I tell people 36 hours after you've given the shots, you should stick your hand in. Oftentimes these does are fully dilated, but they're too weak to push the kids out, and you can just pull those kids. You don't have to do a C-section generally in these cases. And in a commercial goat dairy, I would not recommend it, but that is an option if you have, valuable does, and that is something that is important to you. That's usually the time when you would do it. Some of these goats, generally they don't recover. So this is sort of your final, your last push. It is not a bad option if you have cases that you don't see any other options for. I still, even on my dairy, if I have something that, is, I really like this animal and I want to just try, and something went horribly wrong and, I don't know, things happen and then you have these cases pop up. Inducing can work. It's just, like I said, oftentimes they might milk 50% of what they were going to milk in that lactation, but maybe it's enough that you could get her bred back and try again on another cycle. This is in the notes. So it's just, I really like organizing. I like plans. I like protocols. I like organizing things so that it's easy to make decisions. And so I built this quite a few years ago, but I just like the concept of allocating how you're working and how you're thinking about cases. So this is something we've already talked about, and it's in the notes, and just in the with keeping track of time, I think I'm going to skip this. So prevention management is really where it's at, right? And this is what I spend a lot of time with clients and with myself and with dairies that I'm working with closely with management on. But it's all in prevention, right? And you know that as a producer that you don't want to have these problems. You do know how to deal with them. So we're kind of done talking about the problems, but now let's spend time talking about how to run your dairy and your operation so that you don't have these problems. So hoof trimming is paramount. You know, we should be trimming feet 3 times a year on goat dairies. That in the dry period before their close-ups, all the feet need to be trimmed. If they can't walk, they're not going to eat. You need to have a close-up pen with a close-up diet. That pen needs to be clean. It needs to have shelter. You know, we're talking about snow, wind, rain, mud, water troughs that aren't freezing over, clean, dry bedding. These goats are really at the most sensitive phase of their life in this last month of gestation. And then parasite control. So if you're not familiar with a FAMACHA scoring system, I would highly recommend that you can go online. There's WormX has some great resources, but the FAMACHA scoring is really useful, especially if you're in an area, you know, in the Southeast and even in the Midwest where there's a lot of grazing. Some parts of California, we definitely have issues with parasites, and those pale mucous membranes signify anemia. And that anemia can really be a problem for, I mean, of course, for the health of the animal and during lactation, but in the close-up period, it definitely sends those goats down the wrong path. So we've talked about this, keep your hoofs trimmed, clean out the pens. I really like to get into a scenario where you have 2 close-up pens. Well, really you have a close-up pen for your doelings, your first fresheners, and those are separate from the mature goats. Then you have mature goats, and then you have a pen of weak does and thin does, and anything that catches your eye. If she stands out for any reason, she needs to go into a separate pen. Ideally, it's smaller, but you might have 2 equal-sized pens. You might have a pen that has old does and thin does and just the goats that aren't competing as well, and get them through the fresh period, right? And then they can go in with their counterparts again. And maybe they even freshen into a different pen. But it's really important that those are the goats that are going to give you trouble. And of course, we want to give these goats more room to eat. We're going to talk about that, some measurements. Body condition is important. So here's sort of a range of goats, but obviously the doe on the left is very powerful, and she's fat for sure. So she has a shelf behind her elbow, even in front of her, between her front legs at the base of her neck, you know, the brisket area in a cow, that is, she's got some good fat there also. You know, you don't see any bones. The goat in the middle is pretty ideal. So that's a really nice body condition. She's lean, but she's not carrying a lot of extra fat. The doe on the right is not a great picture. It's very hard to ask your clients if you can take pictures of their skinniest goats. But this is a picture I had. It's obviously not a dairy. Well, it's a dairy cross, but she has horns. But she is under conditioned. So I can tell that just from, even though she has enough winter coat, you can't see her ribs, but she's definitely lighter than she should be. And this is a goat that had anemia and parasites, a severe lice infestation, actually predominantly, and pregnancy toxemia. Okay, let's talk about nutrition now. I do love talking about nutrition and diets and goats. So we're going to go to this now. Pregnant goats can eat 4% of their body weight per day. So you can file that away. Now, when you get into silages and these wetter feeds, that's the same, but you have to account for dry matter differences, of course, right? So, you know, grain and hay is usually around 90% dry matter, 10% moisture, but of course, silages are going to be in that, you know, 40, 50, 60%, somewhere depending on what you've got for baleage or haylage or silage. Close-up does are only going to eat 3% of their body weight. So in that last week or so, when they're really at risk, they're going to eat less. And so in a TMR setting, that's really dangerous because the grain is being diluted out. So oftentimes we will try and find a way to top dress grain on top of a TMR for the last few weeks of gestation, especially if pregnancy toxemia has been an issue. Otherwise, we're going to feed separate. So we do more component feeding in the close-up period. That way they can sort the hay that they want to eat. The grain can be fed. We don't want to decrease the grain when we're going from the 4% to the 3%. That's what I'm getting at. So 4% of their body weight means, and this is just some basic math to give you a feel in case you're thinking, I don't know what that means. It means if she weighs 150 pounds, which is a kind of a lighter dairy dough, 4% of that is 6 pounds. So you would expect her to eat about 6 pounds of feed a day. And that's that's sort of the number you're feeding to. So you might want to think about how much feed you're putting out to your goats, and then do some math and get a feel for what you think your average body weight is and what do you think they're eating. And if they're not fitting into those parameters, you need to evaluate forage quality. Maybe it's too slowly digestible. Maybe they don't like it. That's a big one with goats, right? Is palatability. They're very finicky about even feed that tests well on paper. If they don't like it, they just won't eat it. And then they'll give themselves preg tox just by refusing feed that's in front of them. Review your deworming program. And I'm not saying that means you need to deworm all the time or deworm more, but I think that the timing of deworming is important. And in a dry lot setting, we don't deworm, and you do not need to deworm. So if your goats are raised in barns and they're not out grazing, do not deworm them ever. That's not necessary. But if you're raising your kids or your does are grazing or the dry goats are going out, you need to look at the time of year they're going out. Fecals are really the way to go. They're not expensive. Your state lab can do them for cheap. A lot of local vet clinics will also do them for you, and that's just a very affordable, easy thing. So what you want to do is pick maybe 10% of the group and pull fecals, ideally out of the goat. You don't want them coming off the ground. And then if you find parasites, talk to your veterinarian. If there are parasites present, come up with a deworming program that makes sense. And then usually within 2 to 4 days, up to a week after deworming, you want to take fecals on those goats again and see if you had a reduction in fecal egg counts, because we do see a lot of drug resistance now. There are very few drugs legal, really just Panacur, which I think is fenbendazole, is the only legal dewormer for dairy goats that we can use. So we don't have options. So you really want to avoid this problem in the first place. And so that's where you're going to go over your herd deworming program with your veterinarian. I would suggest reviewing your nutrition plan with your nutritionist. If your veterinarian has a nutrition background, you can start there. But make sure that you start feeding grain a month before kidding. So the far off goats, the goats that go dry at 3 months gestation, they don't need any grain. We don't need to give grain till that last month. So ideally your goats are dry for 2 months. They have a month of just hay and maybe the stems and the leftover feed from the close-ups. And then in the second month of the dry period, they need to go onto a high energy diet. And that's where the accurate due dates are really important. So you do need to know, the blood tests are nice because they're maybe easier, but if you don't actually know when your goats are kidding, you cannot make them a close-up pen and manage them properly. So that is an added expense, but it's a really valuable tool for you, and it will make you better and make your goats better. And then hoof trimming, I can't say that enough. If all you remember from today is trim your goat's feet, then go trim your goat's feet, get that done. You look at both of these goats and you think, yeah, if she had elf shoes, if she had slippers, she's not going to be walking around and doing well. Both of these does had 5 kids. I don't do a lot of sorting goats by body condition, except for what I've said before, which is moving the small thin does into a separate pen. If they're fat or they're normal, and in a lot of cases, we don't do anything and we just let the goats select themselves to be removed, because if she's a thinner doe or she's smaller, but she's competing in the group, then she can stay just where she is. If you noticed, my grain amounts are fluctuating here between 1 and 2 pounds somewhere. It really has to do with the quality of the hay that's being fed, or the silage, and the type of grain and what that means. So this gives you a range, of course. 1 pound for fat does is fine, but you can't go below 1 pound. So you don't want to diet your fat goats. So everybody needs grain. There's no dieting in the close-up period ever. She can milk that fat off, or she can hold on to it for the rest of her life. but we have to give grain to all the goats. We get closer to 2 pounds with thinner goats, with higher production goats, with poorer quality forage. Of course, the grain formulation is going to change. So I'm giving you a range, and I want you to know that you need to put some grain into the diet. And these are safe ranges, but there's obviously going to be a lot of individual variation from farm to farm with genetics and management and weather, right? Is it minus 20 degrees, or is it, it's 55 degrees in California right now? And I'm sorry to all of you in the Midwest, but obviously we're feeding a different animal, of course. I like to get the manger space up to 18 inches per doe, which seems like a lot, but those close-up does need that space. And you need to spread them out quite a bit. Otherwise, you're going to have issues with pregnancy toxemia. So people, you can tell me, oh, I've never done that and it's always worked fine. And that's wonderful and that's great. And it doesn't mean that it can't work at, say, 12 inches, but really, if you want to have a smooth close-up period and a smooth fresh period, you need to give these goats more room. I briefly, I don't really want to talk about small breed goats, but you might be milking Nigerian dwarfs. And so all the stuff we've talked about with the small breeds, I'm talking about Nigerians then, they're going to have about 30% of the feed intake. So you can take all these measurements and drop them by 30% times 0.3, and you're going to get somewhere close to what you need to do for your little goats. I like to have about 5% leftovers at the next feeding. Ideally, you're cleaning out the mangers before the next feeding. And that can get fed to somebody else. It can't, like I said, go to your far off dry goats. It can go to your bucks, but it can't go to your close-ups. You don't want those close-ups slicking the manger. They should be eating down to sticks and stems. And if it's poor quality stemmy hay, that doesn't necessarily count, right? So it doesn't have to be great quality feed, but it can't be the garbage that they wouldn't eat anyways. And keep that in mind that you can't actually overfeed your goats in the last month. That rumen is getting big enough and the energy demand is great enough that you can't overfeed those goats. There's no way. They will never be able to eat enough to satisfy the requirement. So common nutrition mistakes, no grain in the close-up period. We've talked about that, using horse grain, and we're going to talk briefly about that for smaller producers. I've had to work with through veterinarians I knew around the country where there was a client that really wanted to use horse grain, and we're going to talk about why that's a no-no. Low protein diets. So there more and more, as there's more goat dairies around the country, I'm finding that there's more cow nutritionists that are saying, well, it's, a goat's a small cow. It's like, I'll just use the Jersey. I'll make her a Jersey and I'll just make her 160-pound Jersey cow. And then they're running these nutrition models to feed goats off cow formulas, and they're wildly different, and it doesn't work, and it will lead to endless problems. Some you'll see right away, and some you might not see over until enough time passes. But they tend to underestimate protein as part of the issues, and so we do get into problems with cow nutritionists feeding goats and using cow models. Poor quality roughage, I see that in certain parts of the United States. This is actually a dairy in the Netherlands. And these are actually milking goats with horns. The veterinarian was trying to learn how to dehorn goats in the Netherlands. The veterinarian has to do it, and they didn't know how. So there was obviously a lot of issues there with bullying at the manger, because now you can see how much room she has because she has horns. She's keeping the other goats away. But this is their hay. They feed a pelleted diet, and then they feed like a straw that they bed with, and they also feed it to the goats in the manger. But that sort of straw is going to give you a lot of trouble in the close-up period. It's just too slowly digestible to provide nutrients to these goats. Okay, so why is horse grain bad? The sugar and the starch are much too low. That's a problem. Goats are browsers, whereas cattle and sheep are grazers. So goats actually can tolerate a much higher sugar and starch diet than cattle or sheep, which is partly how these cow nutritionists get into trouble. But compared to horses, it's much higher. The fat, horses, obviously not being ruminants, can handle a high fat diet, and goats are ruminants, so they cannot handle that. They need a low fat diet. The high fat almost makes like an oil slick in the rumen, and it coats the fiber that the rumen microbes are trying to digest, and it has a very negative microbiome effect. And then the copper is much too high. And so we do get into copper poisoning issues with goats eating horse grain. And that copper poisoning comes across as a liver issue. And of course, the liver is really it's the nutrient machine in the goat's body. And so when we start putting too much copper in there and stressing that liver, we're really putting a lot of stress on the goat's body and her ability to make milk or to grow kids in utero. Forages, this is, I think this talk is recorded, so you can go back and look at these numbers later. You can take pictures of them on your phone if you need them. But this is what we're looking for in decent quality grass and alfalfa hay. And I just tried to throw something in here together so that, because looking at hay tests is difficult, but you do need to get hay tests when you're buying hay for your dairy. Especially if you're buying hay without a nutritionist, which is fine. You don't have to have a nutritionist, but you do need to make sure that you're buying hay that is decent quality. And with goats, I also like to tell people to get a bale, ask the dealer if you can have a bale of the hay if possible, or some pictures of it to make sure that it looks okay, because hay can test all right and be rain damaged, right? And still have a great test. Or it could be too dry, and the moisture could be too low. And goats don't eat hay that isn't perfect, right? We've all experienced that. On the East Coast, especially in the Northeast, I have found that the ash content can get very high. So when you get greater than 10%, that means that the mower was set very low in the fields. So I've seen, and even in alfalfa pellets also, you'll see their grass hay pellets, they want maximum tonnage off those fields. And so they set the mower so low to get more of the plant that you're cutting through, gopher holes, or I don't know what those are in the Northeast, groundhogs, I think. But the dirt from these piles, you can get ash up to 18, 19, 20%. So you're spending a lot of money on soil that has no nutritive value. And of course, there's issues that we worry about with soil contamination. You could technically get into problems with listeria in those scenarios too. So making sure the ash content is low is sort of indicator of the quality. It also means that the mower was set higher, so you have the stem and more of the leafy part of the plant, or the younger part. An ideal body condition score with goats is 3.5. And we would love to say that all of our goats were there, and they aren't. If as a group you have a lot of really fat goats, you can drop your feed requirement to that group by a 1/2 pound. And if they're thin, under 3, then they need more grain and you need to raise it. Generally, what we do is we feed all the goats the same, and then we make a special needs pen and they get more grain, or they get the same amount of grain, but they're eating less hay. So as a portion of their diet, it's higher. If you are counting fetuses, and of course this is sort of a Pandora's box, because if I am counting fetuses for somebody, I've scanned enough to know that oftentimes I'll see one and say, there's a lot of fluid, I only see one, but I think there's more. And those are the ones that have 5 or 4, because the uterus is so heavy, it's pulled down into the abdomen. And if you don't get them at just the right window, you're only seeing one. And so if I saw one fetus when I was scanning, and then she's fed less grain and she really has 4 or 5 kids in her, that's a problem. But some people scan early enough and often enough that they do get counts, and they want those counts. So you can adjust the grain amounts for the number of kids in utero. Yeah, I don't do a lot of work with Nigerians and pygmies. I'm much more in the commercial goat world, but there are Nigerian dairies. So you really have to, my notes to you would be that you need to really watch body condition. It's very difficult to assess because they tend to carry more, maybe a little fat or have more external fat than a traditional, large breed dairy goat. And they are prone to large litters. So you see a lot of quads and quintuplets in little goats. So the close-up nutrition is very important for these goats. Yeah, we're going to keep going. Okay, so I want to talk briefly about fresh goats. And this is almost a whole separate topic, because of course we get into nutrition and diets. But if you have a good close-up diet, then you're not going to have transition issues. And those does then should really hit the ground running on their lactation diet, assuming your lactation diet is dialed in. So when we start having a lot of, metritis, uterine infections, retained placentas, milk fever, hypocalcemia, in the fresh period, that goes back to your close-up diet. And so if we can build a really good close-up program and not have pregnancy toxemia or hypocalcemia, then we're going to have really great fresh goats. So keep that in mind, that if you're seeing fresh goat problems, you really have a close-up goat problem. One of the common things that I see is that dairies will have a close-up diet and then they go onto a fresh diet, but it's like, oh, we feed canola meal in the close-ups and soybean meal in the fresh goats, and we feed whole corn in the close-ups and crack corn in the fresh goats, and your alfalfa and grass, and we're changing the ingredients, and the goats do not like change. And you know that if you own goats. And so you need to make sure that your diets have the same ingredients. They can be different formulations and different amounts and the ratios, and that is all fine, but new flavors are right out. You don't want to do that in that time period. It needs to be a smooth transition on the same ingredients, even though the diets, of course, should be different. I like to see 90% capacity in the close-ups and the fresh pens. This is obviously very difficult when you're kidding heavy and you've got fresh goats everywhere and close-ups everywhere, and but we're coming into that phase. And so start looking at your pens and figuring out what your plan is going to be so that you don't end up with one pen at 120% capacity. Because what happens is you dump them all in the fresh pen. One day you realize you've got, 20% too many goats in the fresh pen, and you really want to avoid that. That's going to give you problems because the goats that will suffer are the most fresh. So the goats that are 2 weeks fresh, they're going to get up and eat. But it's those goats that are 1 or 2 days fresh, they're not going to compete as well and get in there and eat. And then you're going to see problems with them just because they're competing with goats that are stronger and really on that diet and doing better already. Fresh goats need a big jump in grain. So know that these close-up amounts are not going to be enough for your fresh goats. But you need to work with a nutritionist or with somebody to look at your diets at that point, because your lactation diet does need to be dialed in to get the maximum production and the maximum health gains out of your goats, right? We want to have healthy goats that milk a lot and milk a long time. That's really the goals of this whole process. Oh, I'm sorry. Okay, I thought I just took everything away. Goodness. We want goats to enter the close-up period in great condition. So body condition, we want to do any sort of pour-ons for lice. If you have mites, anything like that needs to be dealt with. We want clean bedding. Of course, we want hoofs trimmed. Can't say that enough. Right back to this. So you've seen all of this, right? Trim hooves, clean your barns, deal with your parasites. In the wintertime, lice is a problem on every goat dairy that's ever existed. So if you haven't done a pour-on, you should. There's many pour-ons. They don't have a milk withhold. A lot of them don't have a meat withhold. It's just a top spot. You just pour it down their spine like you would frontline on a dog or a cat. You just from shoulders to hips, you just make a line. Those work great. I like to keep the young and the old goats separated, especially first fresheners need to be separated from mature goats, but then ideally the old grannies, they need to also be separated. And then, do a sort on mobility, and that should be done daily. If not daily, at least 2 to 3 times a week. You need to make add to your problem pen. Observation at feeding time, we talked about that. That's really important, and it needs to be somebody that is observant. So it can't be somebody that is feeding fast. And when you ask them how the goats look, they say, oh, they looked great. Everybody ate, because you know that that's the wrong answer. Unless you have 3 goats and they're all in your backyard. There's going to always be goats that are a little more hesitant. It doesn't mean there's a problem, but you would want to make sure that somebody is always taking the time to say, well, they look good. I saw some goats that are, maybe walking a little funny, or, they might need to have their feet worked on or whatever. I just don't see a scenario where if you have more than, 20 or 30 goats, where you're not going to have somebody that you've always got your eyeballs on. Early intervention is key, and that's really important, is that we're treating stage 1 goats. And stage 3 goats we're terminating pregnancy on. So that stage 2 is sort of the middle ground, but we want to keep everything pushed back to the early stages of pregnancy toxemia and hypocalcemia. So we're looking for walking stiff, sore feet, decreased appetite. Any of those things should be treated. Don't wait to see if they're going to get better. Don't tell a story to yourself about why she's like that. Treat her, put her and isolate her into a separate pen. She can be in a small group home, but she needs to be separate from the large herd, and then keep an eye on her. It is acceptable to treat those goats and recover them and put them back out. They don't have to stay there till they kid if they're doing well. So some of those goats are going to go in and come back out again, and some goats are going to go in and stay till they kid. And just know that it doesn't have to be a one way, that you can bring them back out again, but somebody that is skilled needs to be doing that assessment. It's the same person probably that would be in the nursery doing the assessment on which kids are doing well and which kids aren't. So that really observant person that takes the time can stand there and just watch, and then, quickly decide, I do or don't think this animal's a problem. So in summary, pregnancy toxemia is a nutritional disorder, and we need to think about it that way. We need to look at our diets and our management of our diets when we start to see these problems. Early detection is key, and then going back to the diets and how those diets are fed, right? That's how we're going to control it. And if you're having issues, then we need to come up with a program for your whole herd that will help you to prevent future cases. Because if you have it now, and if you've never had it, that's wonderful, but everybody should have already dealt with pregnancy toxemia and close-up issues at some point. So it's really looking at what you have now and saying, how do I need to modify this to move forward and have a better season next year, or a better week next week, or a better day tomorrow? Because this is something that you do have control over. As frustrating as it can be and as hopeless as it can feel when it's bad, this is a fixable problem that you can prevent. It is preventable. And this is it. This is the most important thing, right? We have to provide a glucose source, and that's going to be through grain in the last month of gestation. You have to have that. There's no reason why you should not be providing some sort of a glucose precursor, grain, molasses, things like that to these animals.
Again, thank you for being on, and I hope everybody has a great day.